So, how many of you have experienced an illness such as the stomach virus or the flu? I would imagine that most of you here have at least experienced this once in your lifetime. According to the CDC, the hand washing can prevent about 30% of diarrhea-related illnesses and 20% of respiratory infections, such as the flu or the cold. Proper hand hygiene is the simplest, most effective way to avoid getting sick and spreading germs to others and can be completely avoided. I've been a patient care tech for a little over a year, and I'm a senior in the nursing program. So in my field of study and my career, infection control is definitely practiced religiously. And all hand hygiene and infection control all starts with proper hand hygiene and hand washing. Not only is this important in my line of work, which is the medical field, it's also important for the general public. Teaching people proper hand hygiene helps them and the community stay healthier altogether. Today I will be discussing the importance and the different ways to perform hand hygiene and the correct way to properly perform hand hygiene. Proper hand hygiene can help prevent illnesses and possibly death, making it one of the most vital components of infection control. So the first thing I want to discuss is why hand hygiene is important. Hand hygiene is a way to clean your hands to reduce the risk of potentially harmful pathogens. Preventing hospital-acquired infections, which is obviously infections that are acquired in the hospital setting from medical staff. And another way to perform hand hygiene is washing your hands before and after entering a patient room. It's also important in everyday life and not only for the medical field as far as going anywhere in public, touching objects like handrails, tabletops, doorknobs that are touched by multiple people all day long. You are the transmission of any kind of infection that you're picking up. So if you were to touch doorknob or handrails or anything like that, you could transmit that to yourself. And people tend to frequently touch their face, their mouth, nose, and eyes without even really realizing it. And proper hand hygiene can also prevent foodborne illnesses. And this is definitely important in the food industries for people preparing and serving food to consumers, and washing your hands is definitely an important one. Now that we have discussed the importance of hand hygiene, we also want to discuss the different ways to perform hand hygiene. One of the most well-known ways to perform a technique of hand hygiene is normal soap and water. The best time to use soap and water is definitely if your hands are visibly soiled, but soap and water, it should be your first choice if water is available to you. Another technique to clean your hands is using hand sanitizer. So something like this, which is an alcohol-based gel. And the best time to use a hand sanitizer would be if you don't have soap and water available. And definitely if you're touching objects with your bare hands. Now that we have discussed the different ways to perform hand hygiene, we can discuss the proper ways to perform these hand hygienes that are recommended by the CDC. The reason why it's important to properly perform it is to be effective, of course. As far as hand sanitizer, the CDC recommends to follow the directions on the labels. So this one says that you should pump the hand sanitizer into one palm, and you're going to want to use as much as you think you need to cover your entire hands. And then you'll rub your hands and make sure that it's covering the surface of your palms, your fingers, your hands, and making sure that you rub it in until it dries. The next one would be, of course, soap and water. The best way to do it, and this is also what the CDC recommends, is to wet your hands first, apply the soap to your hands, and then rub your hands vigorously for 15 seconds. covering all surfaces of hands, fingers, and even your wrists. And after that, you would rinse and dry thoroughly with a paper towel. Before you turn off the faucet, you'd use a paper towel to actually turn it off. In conclusion, there are many aspects to proper hand hygiene. Hand hygiene is the most crucial component for preventing the transmission of harmful germs that cause illness. We have discussed the importance of hand hygiene, the different ways to perform these hand hygienes, and the effective ways to properly perform these hand hygienes. According to the CDC, washing your hands or using hand sanitizer decreases the number of people who get sick with diarrhea by 23 to 40%, and decreases the respiratory illnesses in the general public by 16 to 21%, and decreases the GI illnesses in school children by 29 to 57%. Next time, you guys, when you're in public and you're touching objects such as handrails, shopping buggies, tabletops, or even your children touching other kids' toys, keep your family safe by washing your hands. Thank you.